Everybody knows that water is important for a good health, but can we make better use of water for our health's benefit? In this video, I will respond to a few questions that may help you to understand how water affects our health. If you are only interested in one particular question, you can skip to the questions chapter found in the scrubber bar or the video's description. So let's start with the first question. Why do we need so much water in our body? There are numerous reasons for why water is so vital to our survival, but the most important are: all of the chemical reaction needed for our body to function occur only when the relevant molecules are dissolved in water. Water is a building material of every cell in our body. Water regulates our body temperature by sweating and respiration. Water helps keep joints lubricated. A component of synovial fluid, water helps to prevent joint friction. Synovial fluid lubricates and cushions the joints and cartilage surrounding them, keeping bones from rubbing together. Water helps to eliminate toxins from our body through sweat or urine. The blood, which is mainly water, carries nutrients to all the parts of the body. All body secretion, like saliva, tears, gastric acid, urine, have water. It keeps our skin hydrated, and as a result we have a healthier look. Now that we know why it is important to be hydrated, let's answer the second question. What happens if we don't drink water or drink too little water? Firstly, our body is starting to be overloaded with toxic substances that are not eliminated properly. Our physical capacity and mental concentration decrease. The risk of kidney stones and blood clotting increases. Our joints will start to hurt and atherosclerosis occurs. The risk of urinary tract infections increases. Our biological aging processes will accelerate. The lack of water affects cell division. Sexual performance will decrease. Digestion and nutrients absorption will be more difficult. For most living organisms, water has a major importance, encompassing a big part of their body. Some organisms even having up to 90% water as their body weight. To have a better idea of the importance of water for our body, here are some facts. 83% of the lungs are water. 79% of the muscles and kidneys are water. 73% of the heart and brain are water. The nerve cells having up to 90% water. 64% of the skin is water. 31% of bones are water. Teeth have 1%. We start by having about 80%, 75% water as a newborn, and, as we age, the water in our body decreases to 65% as an adult, and 58% once we are older. The percentage is lower for women, and people with more fatty tissue have less water than people with less fatty tissue. We saw how important water is, and what not drinking water does to your body. Now let's see how much water we need to drink. For us to survive, we need a certain amount of water depending on our age, gender and environment. Usually, for a healthy life, we need about 3 liters of water or more per day. While not all of this must come from drinking water, as some water is contained in food, drinking other liquids like alcohol, coffee, milk, juice, sodas, tea may have a very small hydration effect, or even have a dehydration effect. For this reason, the best method to ensure that we are fully hydrated is drinking water. In certain conditions, we will need to drink a higher quantity of water. This is needed in case of high temperature, high-intensity physical or intellectual activity, fever, illness, physiological conditions. It is best not to wait for you to be thirsty to drink water, as this may signal the fact that you are already dehydrated, and thirst can be influenced by different factors. Your urine is a good indicator of your hydration status. Darker urine means you need more water. Once you reach a near colorless urine, it means you are hydrated, and you consume an adequate quantity of water. Next, let's see how we can increase our water consumption. Increasing the daily water consumption is the best way to be more hydrated, and it must be done progressively. Since the body has been used with a low quantity of water, it has been used to retain as much water it can, and if we give it a large quantity of water in one go, it will try to retain it all with unhealthy effects. The progressively rising of the daily amount of water we drink, so we can reach the necessary daily intake, must be done by drinking half a cup or 100 milliliters of water, more than the day before, for a smooth transition. When is best to drink water? It is best to drink water no later than 15 minutes before eating, no sooner than 90 minutes after eating, And we should not drink water while eating. These 3 rules are due to the fact that water dilutes the gastric acid, so our stomach has to first absorb the water into the bloodstream before starting the digestive process. If the digestive process is repeatedly postponed, the food digested in our stomach in absence of light and in moist environment starts to ferment, and this will lead to gases being formed in our stomach, which will lead to bloating and flatulence. Also, it's best not to drink water later than 60 minutes before going to sleep, so to avoid interrupting your sleep for going to the toilet. We should drink water while doing intense physical exercise or during intellectual activity. Our brains have a high quantity of water due to the intense chemical activity needed for proper function. This is also the case of the muscles from our body. What happens if we drink too much water? It is very difficult to consume too much water, so water intoxication is very rare. This can happen when you drink more water than your kidneys can get rid of, which is about 20 to 28 liters of water per day or 0.8 liters to 1 liter per hour. Consuming a large amount of water can cause some mineral losses from your body. Sodium is the electrolyte most affected by overhydration, leading to a condition called hyponatremia. To be sure that you don't drink too much water or too little, the best way is to check the color of your urine. Once you reached a near colorless urine, that means you are hydrated. Usually, consuming about 3 liters a day cannot affect you negatively. This is true if there are no condition that may determine you to need more water, such as high temperature and intense physical or intellectual activity. What is the best water to drink? The water should have a neutral pH, meaning a pH of 7, and a temperature near 150 degrees Celsius, 59 degrees Fahrenheit. If the water is too cold, it can affect your stomach, which must in this case reach a normal temperature before functioning normal again. The water we drink should not have impurities like dust, harmful chemicals, dirt, biological contaminants, sulfates, sulfites, nitrates, nitrites, phosphates or phosphites. Tap water contains chlorine, a disinfectant, which can affect the body negatively during a longer period of time, as it can cause eye, skin and stomach irritation, and it can affect the liver. Also, bottled water can contain harmful toxins like BPA and other plastic toxins that can make their way into your bloodstream, which can lead to a host of problems including various cancers, as well as liver and kidney damage. To have all the impurities and toxic chemicals removed, it is best to filter the water. Filtering water can not only remove contaminants and debris, but it can also make your water taste better. Also, it can be an eco-friendlier way to enjoy clean water because it helps you cut down on plastic bottles usage. If you liked my video, please subscribe, like, share and leave a comment. This will greatly improve my channel's health. Thank you and see you in the next video.